On behalf of the Center for Occupational and Environmental Health, I'd like to welcome you to our webinar, Total Worker Health, Implications for Occupational and Environmental Health, with Kimberly Jinnett, PhD, MSPH. A few housekeeping items first. You'll be muted during this presentation. If you would like to ask a question, please enter it into the online chat or Q&A. We'll save time at the end of the presentation to address all questions. When you exit the webinar, a link to the evaluation will become available in your browser. You will also receive a follow-up email with the link to the evaluation tomorrow on October 3rd. Attendees who have participated in the complete live webinar today with an attentiveness score of 85% or higher will be eligible to receive a certificate of completion. Once you complete the online evaluation, you'll receive your certificate as a PDF via email within 1 week. Attentiveness scores are calculated by our webinar provider and are based on continuous engagement throughout the presentation. Some tips on how to keep your score high at above 85% are to join the webinar on time and remain logged in for the entirety of the presentation. Also, do not use your device to navigate away from the presentation. If you're not clicked into Zoom as your primary window, your attentiveness level will significantly lower. Checking emails or doing other work on your device lowers that attentiveness score, so try to keep necessary distractions brief during the presentation if you would like to get that certificate of completion. This presentation is being recorded and will be made available on the Center for Occupational and Environmental Health YouTube page and on our website, coeh.berkeley.edu. At this time, we're pleased to welcome our presenter, Dr. Kimberly Jinnett. Dr. Jinnett is president of the Center for Workplace Health and Performance, a nonprofit focused on research, education, and technical assistance aimed at healthier, longer, and more fulfilling working lives. She has designed, managed, and conducted research and evaluation efforts at RAND, the Department of Veteran Affairs, the Wallace Foundation, and the Integrated Benefits Institute. She is a core researcher at the Interdisciplinary Center for Healthy Workplaces at UC Berkeley and affiliate faculty at the UCSF Institute for Health and Aging. Dr. Jinnett currently serves on several editorial, advisory, and review boards. She completed her MSPH at UCLA in 1990 and her PhD in Health Services Organization and Policy and Sociology from the University of Michigan, Ann Arbor in 1997. Thank you so much for joining us today. We're looking forward to the webinar.
Great. Thank you so much for having me. I really appreciate it. And thanks to everyone who's listening in today. I'm going to talk about total worker health, and I know this may be a little bit of review for some folks and maybe new for others, but I'm excited to talk about it and to give it a little more flesh for those of you who work in occupational and environmental health. There's a central role, I believe, for professionals in OC and environmental health to embrace this more holistic and integrated approach to total worker health and propel the field forward. And many of the ideas I'll present today are not new, and many of you have already been pursuing integrated work or have known about what this total worker health initiative is based on, which is decades of work. And so it's not a new idea, but I think we have some new opportunities now to try to implement this integrated work. So I'm excited today to talk about it, and I'll describe what total worker health is. I'll describe what it isn't, and then I'm going to talk a bit about the value of work and what we know about the societal benefits and the harms when work is good or bad or even precarious. And finally, I will talk about some implications for occupational and environmental health practice and policy. So to get started, what is total worker health? Let me provide a bit of description, and this is a trademarked idea, total worker health, from the CDC and the National Institute of Occupational Safety and Health. So there is a framework on total worker health and lots of public tools available on the site, but in a nutshell, total worker health is defined as policies, programs, and practices that integrate protection from work-related safety and health hazards with promotion of injury and illness prevention efforts to advance worker well-being. So as I said before, total worker health is really just an integrated framework that argues for cross-disciplinary and holistic action around worker health and well-being improvement. So total worker health has many components, and some of the slides I will show today are very dense, so I'm not expecting you to jot it down, and as was mentioned earlier, the slides will be posted. But just to give you a sense of the breadth, which I recognize can sometimes seem overwhelming, but in the past, occupational safety and health efforts, for example, have often overemphasized physical hazards over psychosocial hazards, and perhaps overemphasized acute safety incidents over chronic conditions. And all of these issues are important. So rather than pivoting from one end of a spectrum to another, the idea behind total worker health is to embrace the system and take systemic approaches to change policy practices and the work environment, and measure whether those changes have occurred with implications for real practice improvement and results. So this is one of those dense slides. And again, you don't have to read this, rest assured. You'll see this in the slides with linkable material. And there's a lot of publicly available material on the CDC's Total Worker Health site. So if you don't see yourself represented in this information, I would highly encourage you to contact the Total Worker Health office. They're very helpful, and they're very interested in furthering the Total Worker Health initiative. It is meant to be holistic and systemic. So if it is missing something important, they would welcome you reaching out to them. And I would also recommend a recent book titled Total Worker Health that was published by the American Psychological Association. It's also a very good primer on total worker health. So there are many policies, programs, and practices that fit under the total worker health label. And I'm excited to see that we actually have a great diversity of folks who are listening in today and who represent many different occupational types. So you will hear me refer to occupational and environmental health, but I recognize that there are many other folks on the call today that are interested in worker health, and certainly the total worker health framework ought to be relevant to many different professionals. So ideally, if you're working in a total worker health fashion, you're working in teams that work across departmental lines, that include folks from, let's say, human resources, risk management, operations, benefits, employee assistance, and occupational safety and health functions. So for now, I really would like us to think about your employer and adopt an employer perspective for a moment for some of what we're going to be talking about. This list and the next list, this list right here are some examples of policies and programs. And you may see some things in this list that represent the work that you actually do. It's just an example. There are many other types of programs that fit within the total worker health perspective. And I'd say where there are differences in approach and the emphasis of this more integrated, holistic way of working in total worker health is to get beyond just individual behavior change. Ultimately, at the end of the day, we know we want individuals to change their behavior, but those individuals include not just employees changing their behavior, but supervisors and managers, key leaders making decisions differently, and a whole host of other types of individual action. But mostly what we want to understand here is that even when we have integrated teams, we can't simply rely on integrated team effort to change the individual's behavior. We also need to have this broader, holistic and systemic approach that sort of has a reckoning of the various factors that can conspire to make behavior change difficult. So we often have a lot of emphasis on symptom relief work, and while that's important because it can relieve suffering, and while we also do need to help individuals be resilient in difficult environments, and having resiliency is a protective factor, we also need to acknowledge where there are parts of that difficult environment that we could change. So the closer we get to root causes, that drive the behavior, the better chance there will be for sustainable, long-lasting change. And so we sort of get to the heart of the matter, which is around social determinants of health. And many of you have probably already heard about social determinants of health. And I've often heard from employers in particular, because I do a lot of work with employers, that they often feel like there is not much that they can do to improve workers' health. And they feel like they often don't have very much influence over the social determinants of health. But in saying that, they seem to emphasize the live, learn, and play components of social determinant of health and somehow ignore that work itself is the most proximal social determinant of health for employers to affect. And it is true that many individuals have lives outside of work that are difficult and surrounded by stressors over which the employer has little to no control. But employees spend a good portion of their waking hours at work, and it is this environment where employers have a leading role. And they have this role whether they acknowledge it or not. They can contribute to illness and injury with very poor consequences for both the business and employees, or employers can be intentional and build a healthy work context that supports health. So why is work so influential to our health and well-being? We know that work is very influential, and this slide and the next are just a sampling of the evidence. And just to mention again, as I jam through some of these more dense slides, you'll be able to find them afterward posted. I only go through them to show that, in my opinion, we primarily don't have a evidence building problem here. We have decades of work showing why work is good for health and why health is good for work. And we already know a lot about the ways in which work itself can be pro-social and health generating. And we primarily have what I would call a dissemination and implementation problem. How do we get the right information and evidence and tools into the hands of people who can use those tools and that evidence effectively? And I believe that individuals acting on their own in siloed departments will be less effective than individuals working together across silos using common metrics that connect employee health and well-being to sustainable improvement. We know that certain occupations have greater exposure and higher health risks. Interventions can be aimed at these occupations to help individuals in those roles develop resilience skills, but more importantly, to change elements of the occupation that account for higher health risks. So it's important to note that while some research is correlational and doesn't factor out the potential tendency of some occupations to attract individuals with particular sociodemographic characteristics like income, that may also be associated with poor health. The overwhelming majority of research on occupational health accounts for sociodemographic background and includes these factors like income, education. And so it strongly supports changes to the job and work context when we do control for those sorts of social determinants and somewhat isolate in the occupational category work context itself as a place where changes in shift schedule, protective equipment, better management, more control over hours, and a variety of other things employers can do are ways to reduce stress, exposure, and ultimately improve healthy behaviors as well as healthy outcomes. Indeed, if we look at the differences between the highest and lowest education strata, we see that there are big differences in work elements across ethnic and racial lines. And work characteristics such as low social support, shift work, and low job control account for inequality in lifespans across these different demographic groups. And we also seem to be moving in the future toward more precarious work arrangements. And this new world of work demands more scrutiny and accountability. How can we make this future of work more pro-social and pro-health? When a system is fragmented, there is the propensity to pass blame because no one wants the hot potato to land in their lap. But I've seen some very promising localized work where communities will address the economic development and public health concerns of their local areas in a more integrated fashion, drawing in business and health providers and public and social service agencies. And these organizations all have an interest in making sure that their local community is thriving and supportive of health and well-being. Longtime anchor employers, not just public institutions, not just universities, but anchor employers can be great allies. Hospital systems with a large footprint in the community can be great allies. The local public health department and social service agencies can be great allies. All of these localized groups have a stake and an interest in working collaboratively toward the same objective. Whether the future work is further fragmented or not, these sorts of integrated efforts can be very beneficial professionally and for the community as a whole. So I want to talk a little bit about what total worker health is not. Total worker health is not an off-the-shelf program. It's ongoing work that demands cross-disciplinary action, accountable measurement, and a commitment to learning. So I hope in many ways that this has provided a quick intro for some on total worker health and a review for others. That's a lot on total worker health, and this holistic and systemic framing of worker health may seem a bit daunting to tackle, particularly in light of the changing nature of employment and the future of work. Since work is necessary for economic livelihood, at a minimum for the foreseeable future, how might work itself be more supportive of health and well-being? So as we think about work itself, one study that was commissioned a little over a decade ago in the UK in 2006 by the Office of Labor and Pensions provides a great literature review on the connections between health, work, and well-being. And this lit review found that on the whole, work is beneficial for health and well-being, but that work must be good work. It must be supportive work. It must be pro-social work. We also know the International Labor Organization understands work is central to people's well-being. They understand the value of work beyond simply the income, the economic benefit. It is central to well-being. It is central to how we think about ourselves and the meaning that we derive. The Harvard Business Review asked CEOs to make sure that meaningful work is a top priority. So there's a lot of attention to these, the topic of work and meaningful work. What is meaningful work? Well, it's decent, it's good, it's meaningful. There are many different ways to define pro-social work, to define work that has more positive qualities than negative qualities. This is simply one way of defining it, and some folks on this call may have other ways they prefer to use, but essentially it's trying to capture those elements of a job that are positive for the individual who is conducting the work. It should have a social purpose. There should be recognition and positive relationships with managers and coworkers, autonomy, many different ways to get at pro-social work. And this dimensionality is very much sort of inside the box of what is good work. And ultimately, we want to know, how does good work relate to health, and how can we alter work in a way that is promotional to health? So a good overall source on work and health connections can be found in a special issue of Health Affairs from February of 2017 on the work and health relationship. And this special issue contains a number of wonderful overview papers, as well as detailed guidance around assessing organizational health culture, occupational environments, and connecting work stress to health conditions. And I would really commend, if you're not familiar or haven't picked up that issue, to definitely spend some time with it. It's worth a read. For example, our paper in this special issue was from a study that we did with Pinnacle Assurance, a workers' comp carrier in Colorado. And we found that physical and cognitive job demands affected individual productivity as measured by absence and job performance, and that those sort of workplace demands could potentially be modified to reduce the effects of employee health and prior injury on future productivity. So many modifiable risks in this work context and in the job context. Other topics that we've explored that are relevant here in terms of connecting work and health, performance, we know performance and productivity are of great interest to employers and certainly affect the livelihood of workers. So when employees are ill or experiencing psychosocial stress, they tend to perform more poorly on the job, have attendance problems, have periods of work disability, and perhaps even permanent departure from the workforce. And these effects have implications for business outcomes, including customer satisfaction, timely delivery of products and services, and hitting revenue targets. So we've taken this kind of framing where we really try to connect the interventions that we can do around health and wellness with the sorts of performance and presenteeism and absence and other effects that we see from employees in the workplace. And one of the studies we're currently working on that we're running connects work climate, job, and management context to employee health and productivity with business outcomes. And for that study, we surveyed both employees and managers, and to date have completed 2 sites, a large public county and a commercial health services organization. And we typified the work units across these various departments as supportive or unsupportive based on survey ratings of safety, respect and trust, variety and learning, and workload. And we used items, in that case, from the General Social Survey on Work Climate. These are publicly available items. Some of you may be familiar with it. And what we found when we looked at supportive versus unsupportive work climates is that employers are undercutting any investments that they are making in mental and physical health services when they are putting employees back into unsupportive work climates. And so we do spend a lot of time working with employers in trying to help them understand the more proximal modifications they can make to the built environment and to the work context and job context itself, as well as management training in other areas that can really help to buffer the effect of, in this case, mental health symptoms or physical health symptoms on absence and presenteeism. Those are measures that are important to businesses. They have direct effects, as we showed in the earlier framing, on things like sales and customer satisfaction. And trying to connect the dots in many ways, we have found that CFOs and the senior suite can resonate very well with these sorts of work functional outcomes that map fairly easily to business results. Another area that I would recommend is in that same special issue is around low-wage workers. It comes up a number of times. Dr. Bruce Sherman, in that special February 2017 issue I mentioned earlier, has a paper as well on low-wage workers, and they can be particularly vulnerable to work stress as well. So it becomes important to get ahead of these potential issues, get into more of a preventive space around reducing psychosocial stressors, understanding what those stressors are for employees, how to measure them, and also I think the implications for occupational and environmental health professionals are pretty great in that area in terms of the success that that occupational risk and safety folks have had on physical hazards. I think applying some of the same vigilance and mechanisms and measurement for psychosocial stressors can help to go a long way, and also recognizing that the background of the individual workers can be one of these interactive effects in terms of stress falling more heavily on folks with chronic conditions, with low income, and with more vulnerable situations. So what are the overall implications for occupational and environmental health professionals in terms of adopting this more systemic total worker health perspective and being able to influence it beyond perhaps their own silo? I would like to argue that a place where we can start and where I think we should start and to make progress in this area would be around stress as a major occupational risk factor. And then I think by focusing there, we would necessarily have to proceed with a more integrated, multidisciplinary fashion in order to make headway. So I would strongly encourage a greater focus on stress, and that we can be more aware of the occupations and job types that may be particularly susceptible to stress in either your own organization or perhaps those you work with, or that you're aware of from existing research. And do you have a survey, for example, on employee stress, or know where you could obtain one or obtain results from one? Do you have a way for employees to contact someone in your organization before a crisis occurs, particularly as it relates to psychosocial stress, which tends to go under-noticed until a crisis does occur? And I would also say that integrating with your colleagues in other areas, such as an employee assistance program or in HR, to discuss work-life balance challenges. Do you already integrate with colleagues in those areas? Do you ask about work-life balance when you're meeting with employees? Do employees ever contact you about these sorts of issues? Would you say your organizational culture is supportive of work-life balance? If not, or even if, is there a senior leader who acts as a champion or could act as a champion? Are there folks who can tell their own stories? Stories can always be powerful, and particularly powerful from senior leaders to help shape and set that culture. And probably the single biggest issue that looms large but often goes under-addressed is poor management. And the implications for the human resource department is very big here. Often directors of operations already know when they have management issues at a regional unit or department level. And again, is there a senior leader or a cross-department senior team that can provide the guidance and leadership to support work across silos to improve supervisory skills or better health and performance results? And oftentimes these difficult management situations are actually quite well known. They're just not well documented in a way that's actionable. So it's making it just more visible of what are the pro-social ways of managing, and then making sure to provide opportunities for training and for placement that make more sense in terms of stronger management and healthier supervision. So while we want to move toward more prevention on balance and reduce psychosocial stressors, we also recognize that about half of our workers have at least one chronic condition, often more than one. So we need ways to apply these total worker health principles to this group of individuals in order to avoid safety incidents or the ill effects of untreated conditions. And we know that work stress also affects chronic conditions like hypertension and a variety of other chronic conditions. And employers can review how healthy their environments are physically and psychosocially. So adding both components and understanding what it looks like unit by unit or department by department, and make changes to improve these environments, including the built environment, while you continue to target individual behavior change and disease management. The problem is that many companies are moving toward mechanisms of cost shifting that make it much harder for employees to engage in preventive behaviors or even earlier treatment. And we found in studies we've done with medical officers, chief medical officers of large employers, that, for example, high deductible health plans are primarily designed to save money based on the assumption that inappropriate utilization will decrease when individuals have to pay more for care. But the problem is there are few, if any, adequate controls against decreases in appropriate care. And a recent RAND study after the passage of the Affordable Care Act found that the majority of individuals didn't realize that an array of preventive services were now covered without the need to pay the deductible. People were simply avoiding all care in an effort to avoid the deductible. So how can we ensure that those who need care get care, while also helping to prevent disease onset and progression from the very get-go? And I believe that this total worker health perspective, including cross-disciplinary and cross-sector work, is the most fruitful direction. It requires us to work in an integrated fashion and understand different perspectives. And I do believe that instead of focusing only on claims data, which really is just the tip of the iceberg, we need to focus on the broader impact of health in the business. I believe that occupational and environmental health professionals and programs are in a central and unique position to find allies and lead the change in this area. But it's tough to think about how we can get there sometimes. And I think we need three components. We need allies, we need strong measurement, and we need integrated learning. So where do we start? And we often start by just digging deep, by not accepting crises only, not accepting the tip of the iceberg only, or only the late in the game interventions that, after the disease has already been acquired and has become a chronic condition. We'll always need to have strong disease management, but we also need to move toward prevention, especially around psychosocial stressors and the work-life interface. And interdisciplinary and integrated approaches to improving workforce health and performance will help us to build more sustainable change and learning communities in the process. There are many freely available tools on total worker health on the CDC National Institute of Occupational Safety and Health site to get you started. And whether you use in-house expertise, subcontractors, or a combination of both, the key is getting started with a big picture of health at your organization rather than layering on more and more data collection. It's better to understand how the data you already collect can be brought together as part of a whole picture. Understand why you currently collect the data that you do. Is it primarily for compliance purposes or to track spending? These are very important business and compliance functions, but we also need to understand physical and psychosocial stressors in the workplace that can be managed and modified through changes to policy, practice, or the work environment. And we move toward those elements that are closer to the root cause rather than symptom management when we can dig deeper and when we get below the surface of just the crises that we see and that we currently measure, to measure some of these deeper factors and discuss some of these deeper factors that become preventive and pro-social for the system as a whole when we can change them. So with that, I've reached the end of the content on what I was going to present, but I look forward to hearing any questions you may have. And I know we'd like to open it up for questions now. And I think there's the chat function as an option for that. And I believe Michelle will be coming back online to help field some of those questions. And you can also always feel free to email me as well at any time. After we're done with the webinar, I'll be able to respond to emails. But I'll respond right now to any questions we might get through the chat function. So thank you very much.
Wonderful. Thank you so much. We do have some questions. So as Dr. Jinnett mentioned, you can enter any questions into that webinar chat. There's also a Q&A, so we'll be going through and reading questions aloud in those places. So please feel free to enter any questions that you might have now. The first question that we have is, could you recapitulate on how low-wage workers and which approach is based on the stress-related workers? So maybe just speaking a little bit more about low-wage workers and stress.
Yes, so I mean, I'd say in many senses, I've mentioned resilience a few times here, and this is very much related to the stress effects on low-wage workers. So, there's a lot of activity in the field right now to offer mindfulness approaches and resilience training to individuals to help them be able to deal with stress, whether that's coming from the work environment or from home or from a variety of other sources or those in combination. Resilience training is incredibly important because it can help all of us be able to deal with stressors more effectively. But my argument there was when we have inequities that exist because of other dimensions, for example, poverty or being a low wage worker. And it becomes even more important that those individuals have some resiliency to be able to deal with the stressors, but they're also being subject to more stressors than individuals who would not, for example, have as much of an income issue. So we're talking about where work and life intercede, and interact with each other. And so it's important in two fronts for understanding, what proportion of your workforce are low-wage workers, and understanding that there's going to be more stressors on them, both financial stressors as well as simply being able to focus and be able to get the job done at a high level of quality if they're underpaid and maybe don't have a living wage. So that's a very proximal area where employers can have some effect in terms of whether the pay and the benefits that they're offering that worker is actually representative of a living wage for their community. So that's one kind of holistic and systemic way to approach it, is understanding what's a living wage for the workers that you're working with in your area. And if there's an imbalance between that and the wage that's being paid, that's a big risk for that individual in terms of being more susceptible to psychosocial stress in the workplace. And then having hypertension and other issues that come along with being exposed to stress. I don't know if that answered the question that the individual had, but that's what is part of being aware of low-wage workers and being more vulnerable to work stress.
Great, thank you. We also have a question regarding any case studies that you might be able to point to on the total worker health approach and the success of approaching work that way.
Yes, I'd say I would highly recommend going to the website, which I have linked on the slide that you're looking at right now, as well as I think the new book that just came out this year titled Total Worker Health is very worth a read. There's some case studies in that text as well. But the website also has a lot of good examples of total worker health approaches. I think most of these successful approaches really have integration and this sort of cross-disciplinary and cross-sector work as a core, and recognizing that multiple different types of intervention come together to create this overall pro-social system, essentially, to make sure that work is not hindering health, but it's being as supportive as it can to the health of the individual, because that's required for the health of the business.
Excellent, thank you so much. I'm curious too, if we revisiting the idea of gig work and the future of work. There's been some recent legislation around gig work in California, and I'm curious if the total worker health community has been communicating about that at all, or if that's been a topic of conversation.
Yeah, I think it's definitely within the total worker health discussion, as well as probably anyone who's doing worker health work right now. It's often termed precarious work. So this notion that all of these elements that we know from research represent better work or good work, like stability, like knowing where your resources are going to come from, knowing what your schedule is going to be, having some certainty around where your wage is going to be coming from. And those can all be challenged and more difficult in a gig work environment, where individuals may have to have more than one job to make ends meet, and may not know how long they're going to have that job. They may get their hours provided to them week by week, which makes it difficult to budget and know how much they're going to be able to spend in a month, for example. We are moving more toward a gig economy, and there's a lot of work and research in this area right now. There's also some potential for some of that gig work to not have to change from being gig, but to be more pro-social, in the sense of having better benefits in some of these dimensions that are considered part of supportive work. So one interesting area in gig work that is starting to bubble up as being pro-social is autonomy. And we know from work and research on positive work that having autonomy on the job can be very beneficial for the worker. And sometimes gig work can provide that, but there's also on balance some aspects of compensation and resource access and control over your own schedule that can also be difficult. So it's definitely an area for further work and research.
Excellent. Thank you so much. And for everyone online, we do have the slides are going to be available. So if you want a copy of the slides as a PDF, you can email coehce@berkeley.edu and we'll send those back out to you. We have another question following up on the gig work question. Do you see a good way to encourage business owners, CEOs, and leadership to apply total worker health principles?
Yes, I mean, this is a terrific question. I know that there's been a lot of local work, localized discussion and work around whether it's gig workers coming together as a union or more informal mechanisms that CEOs and employers could maybe encourage among contract workers and other gig workers. We have seen shifts in certain areas of employers using more part-time labor and gig and contracted labor. And in doing that, they're giving up some of their control that they might have over helping to improve the social and health conditions for those workers. Sometimes employers may think that they're shifting cost a bit by doing so, but they're actually not shifting the risk away from themselves. So they still may have to deal with a gig worker or a subcontracted worker who has a health issue or a safety incident or even a criminal activity that may occur. And we're seeing that, it was mentioned earlier in terms of legislation. So I'd say some of the more progressive efforts among employers and CEOs are recognizing that whether they acknowledge it or not, they have a role to play. They do play a role. And so as the world of work in the future work's changing to have more of these gig and contracted relationships, there's still a big role for employers, particularly in localized and regional settings, to play in understanding how they can be supportive of more healthy work.
Great, thank you so much. We also have an attendee who wanted to attest to the importance of this approach. 20 years ago, they had a high level of lost workdays, restricted duty, and illnesses at a 200-person call center, and then began taking a holistic interdisciplinary approach across departments and disciplines. So thank you, Joe, for that comment. We also have another attendee who had a comment. He was saying that a lot of low-wage workers can view total worker health cynically, since programs like BP screening or smoke cessation programs, et cetera, are not necessarily a priority for them. They might need more money, more control of their working conditions, and less time pressures at work. And total worker health can be seen as a senior management trying to gloss over some of the more work conditions with things like lunch walk programs. Whereas in EHS, there is a reality for most workers, medical risk factors are impactful on the worker and their family health. So I guess if you have anything to add to that comment, I'd be curious.
Yeah, no, that's a great comment. And I'm seeing the full comment here too on the screen. And that's
great.
a really great comment. And I think it suggests, a difficulty in, how can we have more of these holistic and systemic approaches, which total worker health is, in a space where we have, wellness services and various disease management programs and, many different types of interventions that can be offered or services that can be purchased and provided to your workforce. And so the fact that we still have this confusion in the field around what total worker health is not surprising to me. It is a systemic holistic approach. So if there are folks or if senior management is using it as a way to, show a checklist of a variety of different programs and say, check, 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 we're doing stuff across all these areas, that's not total worker health. And so, I would really recommend that one slide I put up, which is what total worker health is not. Find that slide when you download the slide deck. That's not total worker health. Total worker health is a systemic, holistic approach. There may be walking fairs and good food options and other things like that are part of an integrated total worker health approach, but they do not on their own represent total worker health. What represents total worker health is the way and the process by which you approach improving worker health. And you have to have folks working together across these lines. You have to measure and hold yourselves accountable, and you have to use the information that's being used to improve. If you're in an organization that year after year after year, first of all, you may not be measuring worker health at all. But let's say you are measuring worker health, and year over year over year, worker health is either the same or declining, then you're not doing total worker health. Total worker health is really, at the end of the day, about trying to improve the outcomes for workers. And so it really has to have this accountability mechanism. And if you're in an environment where it feels like lip service, then you're not doing total worker health.
Thank you. Another person wanted to follow up and ask what you've seen in terms of hard performance metrics demonstrating benefits to an employer, particularly if by referencing lagging indicators, the company, let me see here. They're wondering if you turn to soft feedback such as employee surveys.
Yes, and so I am a big believer, I'm a researcher at heart, and I'm a big believer in mixed methods where we use both quantitative information as well as qualitative information. So, I think we tend to over rely on quantitative information as if there's something magical about it, and we don't actually question it or dig deep on it very often. And a lot of times the quantitative information that's being gathered, whether it's claims activity or anything else, hardly represents the population. It represents a very often small proportion of the population. And as employers, we ought to be interested in the entire workforce. And so as we shift people into part-time jobs and gig work and don't benefit them, we're having fewer and fewer, less representation in those quantitative databases. So I'd say, in addition to the question, the person who asked the question notes that surveys can be what's called soft feedback, and there are these lines between hard measures like claims data, like I mentioned, and then what's called a soft measure, which is really considered more subjective because somebody can answer a question. But I don't like that distinction very much because it presumes too much about those hard measures, as I noted before. So we have to scrutinize the data that we're using to make decisions. And those data that we're currently relying on often don't really represent the whole workforce. In terms of more subjective information and getting information that's really from the mouth of employees and individuals, there's such tremendously useful information that can also just be gathered by talking to employees, by having focus groups, by having anonymous suggestion boxes, by just engaging employees more in some of the solutions. And, we've seen great promise from employers that embrace that sort of employee feedback and are able to go much further, faster with better programs that are going to help them as an employer, as well as really meet the needs of the employees better. So I would just really very much encourage relying on multiple types of data and making sure that you are speaking with employees.
Great, thank you so much. And we have a couple other questions. I think they're kind of tied together. If there is any sort of reference metrics that people could use to point to see if their company is below an industry average, or metrics to help make the case to get stakeholder buy-in and to measure progress.
Yeah, I'd say I think one of the best tools, and I am biased because I worked for the Integrated Benefits Institute for about a dozen years, but I think if you're just getting started as a company, a great place to start would be with some of the tools that the Integrated Benefits Institute has. And it, they can help for relatively low cost, provide a snapshot report for example, the industry that an employer's in, of what some of these broader measures are that are important. So even if you don't have your own data, having one of these kinds of reports on the full cost, let's say, of illness in your company, measured not just by medical claims costs, but including things like workers' compensation and short-term work disability and family medical leave. These are reports that are based on a very rich benchmarking database that IBI, the Integrated Benefits Institute, has, and can be a really good conversation starter and case-making piece for getting the attention of your C-suite.
Wonderful, thank you. We have another question. If you could weigh in on the perception of the approach towards zero harm.
Okay, I'm not familiar with the formal zero harm, if there's like actually a former zero harm platform that this individual is asking about. But in terms of doing zero harm, I'd say the one I'm most familiar with that's sort of related to this is the idea of health in all policies. So HIAP, health in all policies. And this is the notion that across a company, in every single function you can think of, that health ought to be a part of what that company is thinking of. Health for the community, health for the employees, health in everything they do. So even something like purchasing, the purchasing function, which is typically seen as extremely separate from any kind of OC health issue, we could see that there are ways to make sure that health in all policies is also a part of like a purchasing function that you might want to require in any contract with any supplier that you would work with, that they too are following principles that are health in all policy. If there was more to that zero harm, it might just have to be with my lack of knowledge on any specific formal program on zero harm.
Great. Well, thank you so much. We do have a few more minutes for questions if anybody has another question they want to ask. But I would like to take this time to also thank you to everyone who joined us for today's webinar, and a special thank you to our presenter for bringing this to us and sharing your knowledge with us on total worker health. We typically host webinars the first Wednesday of every month from 12 p.m. to 1 p.m. Pacific. We do also have a special webinar tomorrow happening in cooperation with the California El Camino Real Association of Occupational Health Nurses. That'll be 3 p.m. to 4 p.m. Pacific tomorrow on workplace preparation for wildfire smoke health concerns. We also have a webinar series with the NIOSH Education and Research Centers around the country on ergonomics. Our next webinar for that will be on October 23rd, and that'll be on leg and neck muscle fatigue, illustration of physiological mechanisms that can lead to musculoskeletal disorders. So make sure you can find all of these events on our website, coeh.berkeley.edu. And make sure you can check back on our website for more information and to register for these events. We also have another comment. Great information. Thank you so much for the presentation and discussion.
Well, great. And please feel free to follow up with me afterward as well if you have more questions, or if you have examples of total worker health. I'd love to hear them and make them more visible on my site.
Wonderful. Well, thank you, everyone. I hope you have a great rest of the day. And thank you again for joining us. All right, bye-bye.